I'm going to show you a couple different examples. We're going to use a couple different tools, but we're going to say that it's my right knee that had the replacement. I've got a standard forward wheel walker. This is a very common presentation for patients being discharged from an outpatient surgery center or a hospital-based practice. Typically what's going to happen, hopefully you have a driver, somebody who's going to open the door for you. But even if it's you opening the door for yourself, typically what's going to happen is you're going to come over equal with the door, you're going to start to open it, you're going to negotiate so that you can pull the door open while clearing the walker. Now we're going to come in where we turn so that our backside is right up against the seat. I've got the Pure PT stretch strap that I'm going to use as a leg lifter because most of the time patients don't have the hip or knee strength to lift the leg into the car. I position the walker so that the back of my legs are touching the side of the car. I sit back into the seat. Whoever is helping me would take care of the walker. I'm just going to move it out of the way of the camera for a minute. And now using the stretch strap, what we're going to do is, if it's my left leg that had the surgery, I'm going to use the strap to help lift and pull the leg into position. If it was the right leg that had the surgery, it would be even easier because my left leg could go in first. And now as I lift to pull the leg in, the strap is assisting to get the foot into position. But a couple tricks. So one thing that you can do is you can slide the seat back. I'm sitting, I lift the seat, I slide it back. I can also recline the back of the seat so that there's more room for me. Again, let's pretend it's the left side. There's more room for me to get the leg in or get the leg out. If it's the right leg, same thing. I slide back into the chair. I get the leg into position. Once I'm here, we're ready to go. If I'm coming to therapy, I've got the stretch strap. I loop it over the foot. I lift, lower the leg, bring the other one out. Now from here, I would typically leave this in the car. Whoever drove me brought the walker to me. Now, one of the mistakes that you see is patients will want to grab the walker to pull themselves forward. What I would rather have somebody do is brace against the door and the door frame, lean to get up first, then you grab the walker. And now this is where you would start to move. You would get out of the way of the closing door. Whoever's with you would close the door for you. All right guys, so a couple little tricks if you're trying to help somebody get in and out of the car on the passenger side. The first thing that we want to do is we want to recline the back seat, the back support of the seat, so that when the person comes in, they can sit, they can scoot back, and they can bring the legs in. Something else that will make it easy is we slide the actual chair back. So now the seat of the car is back as far as it'll go. The person coming in would still sit on the front edge first. Then as they maneuver, they could slide back. And you can see here, I hardly have to bend the knee at all. If I have one of the stretch straps available, I would use this to lift and bring the leg into position. If you have leather seats or cloth seats and it's too hard to maneuver, sometimes people will put a trash bag on top of the bottom so that when you're pivoting or turning, it's a little more slippery and it's easier to maneuver in and out of this position.